Next, I would like to invite technologist Dr. Mimi Nurakmal binti Mustapa, the Senior Assistant Director of the Planning Division of the Health Informative Center, to proceed with her topic of Malaysia Health Data Warehouse System Architecture. We welcome her on stage.
Assalamualaikum and a very good morning to all. Salam sejahtera and salam Malaysia Madani. First of all, I would like to thank MTR Conference Collaborator Secretariat for inviting me to give a talk on MALAYSIAN today. Okay, so today I'll be talking about Malaysian Health Data Warehouse MALAYSIAN architecture. As we all just heard about MALAYSIAN just now, so it is essential for us to know what is MALAYSIAN is all about. Okay. So my presentation will be based on this outline. We will start with introductions, followed by technical specifications. We will look at MALAYSIAN data flow, MALAYSIAN system architecture, and a little bit about data process view. And if time permits, we will see the privacy assurance services. So for those who don't know what is MALAYSIAN, let's start with the introductions. MALAYSIAN is the abbreviated version of Malaysian Health Data Warehouse, and the working definitions in the 2011 blueprint document as a trusted source of truth of comprehensive healthcare data structures for query and analysis purposes. MALAYSIAN enables centralized collections of data from multiple sources. MALAYSIAN has been optimized to enhance user experience to analyze and produce reports based on their needs and purposes. These applications provide quality, integrated, comprehensive, and timely health information, integrating all the data in one data warehouse as secondary data use. Analysis and reports from MALAYSIAN enable users and related stakeholders to implement evidence-based decision-making, thus improving the user skills in health informatics standards. Furthermore, MALAYSIAN enhance the interests of our stakeholders by employing an overarching healthcare systems governance. These are some of the reasons why MALAYSIAN can carry the notions of a trusted source of truth. MALAYSIAN carry the objective to be a centralized, integrated, comprehensive, timely health data and information for evidence-based planning and decisions making. To realize this objective, we have outlined certain criteria for MALAYSIAN. MALAYSIAN was developed in 2015 and has been in operation since 2016. The Health Informatics Center Planning Divisions of Ministry of Health Malaysia is the owner of this and custodian of MALAYSIAN due to the PIK functions as the official source for health data and information for Ministry of Health. It is a web-based applications that can be accessed at any time and anywhere. MALAYSIAN data is almost real-time because it will be updated every 24 hours. Thirdly, it is comprehensive and integrated because MALAYSIAN collects data from all public and private sectors healthcare facilities, thus allow MALAYSIAN to process data from various facilities. It also covers all healthcare facilities, including hospitals and clinics, and all services comprises clinical support, traditional and complementary medicine. MALAYSIAN also embraced the artificial intelligence through the MyHarmony applications. MyHarmony application acts as the tool to harmonize the codified clinical terms in unstructured data or narrative text with an analytic components to demonstrate higher value in identifying cardiac cases as compared to equivalence to queries utilizing structured data and classifications or ICD-10 approaches. MyHarmony has been further refined to handle post coordinations and contextualizations in alignment with SNOMED City guidelines. And in terms of big data analytics and next generations analytics, MyHarmony is capable to facilitate and has a direction to increase utilizations of unstructured data and semantic data integrations. So MyHW employs the notions of build once and use many, with the objective to reducing the burden of data collections and processing. This implies where possible aligning primary and secondary usage considerations. MyHW is a homegrown local technology support built by our technology partner Mimos Berhad, or which supports the continuations, developments of MyHW through the creations of Center of Excellence and skill, internal resources through best practice and from international experiences. So this is the landing page of MyHW. Once you have the access to MyHW, depending on your user access roles and facilities, the user will gain access through what they has been assigned to. So if you are ARP user, you will only see ARP module here. But if you are more than the ARP user, such as SMRP, PRIS, or any other modules, you will gain access and you will see more than one link to access your modules. So some technical specifications about MyHW. Firstly, our operating system for all our servers is using CentOS and Ubuntu. And MyHW has been developed using Java applications programming. And the third and most important part is the database, that because MyHW has to cater high volume transactions in data, so we resort to Postgres SQL, which use Enterprise DB 11 versions as our relational database management systems. The fourth one is Apache Tomcat, is where our web servers. And currently our data center resides in Mimos data centers because Mimos data center is capable to handle our huge amounts of servers. Let's take a look at the MyHW data flow. There are three main parts in here. The first one is the data for primary use. So we have three main sources for our incoming data. So MyHW cater three scenarios from mainly inpatient data from MOH hospitals and non-MOH hospitals. So for MOH hospitals which without systems, so if the hospital has no IT systems, the user will have to directly enter information about inpatient data into SMRP. And if this hospital has IT systems such as HIS or KKM or SPP, SPPD or HIS Softdeck X, we will have integrations through SMRP. While for patient registry information systems, the user will have to enter the clinical informations because the demographic has been obtained from SMRP. For private hospitals, whether with or without systems, they have to enter directly to SMRP. Only a few private hospitals have been integrated with MyHW, when we are planning to integrate more than private hospitals with MyHW. Same goes with PRIS. The user from private hospitals will have to enter manually the clinical informations for patient registry information system that consists of cancer patients. So for outpatient data, mostly comes from MOH clinic and dental clinics. So the user will have to enter the information to e-reporting family health or oral health for dental. And for MOH clinics with systems such as TPC or CHIS, the informations will directly flow to our ETL process. That means the user doesn't have to enter 2 times at TPC or CHIS or at SMRP. So we directly integrate the information to our ETL process. And the middle pane here is the MyHW source systems. accessed via the portal just now and show you. The first one is SMRP, collect our information, inpatient data, mostly our inpatient data. The priest collect the cancer registry and NCD data, while e-reporting collect data from MOH clinics and oral health clinics. So this is our ETL process: extract, transform, and load, where the data will be extract, transform into a data mats, and load into our MyHW portal. In MyHW, the primary task is to process and produce data for secondary data use. So the ETL is the main task for MyHW portal, and then the data that has been transformed into data mats can be utilized by our statistical tools to produce outputs such as fixed format report, ad hoc query, or KPI and management. The privacy assurance services is the service that encapsulates privacy, that transform our informations to separate between personally identified informations and de-identified data. Next is our data modeling related to data mats. Our business intelligence is to produce the ad hoc query. And we have also a GIS, Geographic Information Systems, where we can plot our data into a map. And one of the significant contributions of GIS is during the COVID-19 outbreak, where we produce a dashboard for our top management for them to view daily cases for COVID-19. And also about harmonization and codifications, as I mentioned earlier, about the artificial intelligence that we embrace. And lastly, for infrastructure and management tools in MyHW to manage the user profiles. Then we have the output for MyHW, fixed format reports being used a lot by hospitals user, ad hoc query for utilizing the data maps using statistical tools, and GIS-driven maps and dashboard coming up from these GIS modules. We have analytics for research, and lastly, analysis for unstructured data using LFP by using this harmonization and codifications modules. Next is the MyHW system architecture. This is the greater details of MyHW. In the leftmost pane is the MyHW incoming integration. As I mentioned earlier, we integrate systems from hospitals. So some of the systems listed here, such as HIS at KKM, HIS sistem sakit, pengurusan sakit dalam, sistem pengurusan pesakit, even PHIS pharmacies. I kelahiran if I'm not mistaken, from Sarawak. TBC OCHIS for our primary health clinics, blood bank information system, and self-registration systems that manage our user registration. So these are the incoming integrations system that sends the data to MyHW. So inside MyHW, we have the main modules of MyHW, consists of our portal, the landing page, user registration, as mentioned by Puan Rohani just now. She managed user registration, all modules, including ARP in user registration modules, GIS to map to plot the data and produce GIS informations, MyHarmony for the artificial intelligence module. And we have the dashboard that produce World Health Organization chips, KPI, trend, SDG, performance indicator, and also the business intelligence modules that produce ad hoc query, statistic or predictive analytics, and fixed format reports. Other modules comprises of e-reporting family health, which has 7 other sub-modules, SMRP with other 7 sub-modules, PRIS for cancer, NOR and non-communicable disease. Oral health consists of primary and specialist. The privacy assurance service module is to cater the privacy measure of our informations. And lastly, the security module that's the standard module that govern our MyHW infrastructure from any cyber attacks or malicious attack. And then we have also the outgoing integrations. Apart from incoming, we also send data out of MyHW, such as CaseMake for inpatient data, and the National Registration Department for births and mortality. And lastly, we have the ARP application, Registry Pesakit. This is where MTR resides in. So currently we only send, ARP only took demographic data from SMRP. So, but not all informations or all demographic data come from SMRP. So some of the demographic also being keyed manually inside ARP. So each of the registry took the demographic data from SMRP and managed the clinical information individually. So we have the MGIR, it should be MGIR here, gastrointestinal registry, neonatal registry, neural, I can remember by MRC, Malaysia Trauma Registry, transplant, inflammatory arthritis, neurology, and dermatology registry. Currently, we have 9, although there are a lot of registry out there that does not reside in ARP. That is out of scope from our framework. So this is the privacy assurance. Sorry. Okay, let's look at the data process view first. Okay, so in order to manage the data inside MyHW, the data has been categorized to 2 types. The first one is data with personal identifiable information. Second one is data without personally identifiable information. So once the data has been integrated into our SMRP system, the data will flow to the normal trust zone first. So the user that will have the access to normal trust zone consists of only normal user. Only the privileged user can access the high trust zone. So once the clinical information or admission and discharge information has been entered by user in SMRP or PRIS, the data will flow into a high trust zone. So in high trust zone, only privileged user can be accessed, mostly from Ministry of Health ourselves. And then once the data has been completed, and it will be sent to this privacy assurance services. In this privacy assurance services, we have 3 main process. The first one is the identification service, which are the pseudonymization, the data scrambling. The data scrambling process will be employed here before we separate the personal data. Then the personal data will be stored in personal data stored, while the rest of the information which has been de-identified will be sending to the landing area. So from time to time, we can have the re-identification service depending on the cases. Let's say we want to identify cases which we want to know who's the owner of the data. We can do the re-identification service, but that will take a few security measures to perform. Now we have the landing area. Let's say we have de-identified data. The data has been sent to landing area. So in the landing area, the ETL process will be performed. This is the extract, transform, load. So after the first ETL process, the data will be sent to the staging area, and another ETL process will be performed before the data can be turned into data marts, which can be utilized by our business intelligence tools or other apps to perform any analysis and produce reports or ad hoc query. So let's demonstrate some privacy assurance services. Let's say we have these sets of data. It consists of name, IC number, address, dates of birth, postcode, city, and diagnosis. In MyHW, we consider this as the PII, personally identified information, while this can be de-identified. So this data will be sent to the privacy assurance services. And the privacy assurance services will perform the pseudonymization service. and turn it into output as identifier index or virtual person index. Okay, so we perform summarization here, and two separate data set will be separate by the first data will have the identifiable index. The second data set, which is the identified data, has the virtual person index. So these two keys are the main keys that will integrate those two data sets from the original data. So apart from the de-identifications, we also have re-identifications. Let's say we want to identify one person and we have these data sets. As mentioned earlier, the de-identified data has VPI. So with the VPI, we can perform a pseudonymization service, and the output of the pseudonymization service is the identifiable index. And we take the identifiable index to identify the person inside the personal data store, and then we can know who's the owner of the records. So at any point of time, there's no way we can know who's owned the clinical informations. The personal data is always stored securely and privately without access from the normal user. Only the privileged user at the ministry level can have the access of the personal informations. So we can say that at this point, the data that stores in Malaysian Health Data Warehouse is very secure and safely, the privacy is safely secured. So to perform the re-identifications, we need two access here, the pseudonymization service and also personal data store. So only the users that or the person that has been assigned through our digital our data governance can access the re-identification services. Yep. I think that's bring me to the end of my presentations.